Welcome everybody to the chapter on contemporary and legal issues in abnormal psychology. There are several prevention efforts listed here as interventions. We have universal interventions, selective interventions, and indicated interventions. And these are our modes in which we use to help prevent different mental disorders or individuals in case of natural disasters, things like that, to help people who are very, very anxious or become depressed or something like that. We term these as interventions, and they're at three different levels: universal, selective, and indicated. And let's look at each one a little bit more specific. So for universal interventions, the key task here is to alter the conditions that can cause or contribute to mental disorders and establishing conditions that foster positive mental health. So you can understand that these are going to be very, very wide scope issues here. And I was trying to get you an example. Virtually any effort that is aimed at improving the human condition would be considered part of universal prevention of a mental disorder. Okay, so under universal interventions, you have biological strategies where they promote adaptive lifestyles to maintain good physical health. We see commercials and ads, magazines, and so on, where they're really trying to promote adaptive lifestyles. They know that people that engage in exercise are going to be healthier, and there's less of a incidence of anxiety or depression for the most part, right? Psychosocial strategies, skills related to problem solving, emotional expression, relationship building, accurate frame of reference, and preparation for life stage problems. Okay. Also, sociocultural, creating safe communities, creating social conditions to foster healthy development and functioning, going to be very, very important. That these universal interventions, even though not targeting any one specific disorder, but from what we know in developmental psychopathology, that during these different developmental time periods for kids, they need certain things, and not only do they need certain things, but they need to be sheltered from other things, right? So creating an environment, a safe community, is going to be very, very important for decreasing the chance of mental disorders later in the future. Now, what about selective interventions? Now, these are aimed at a specific subgroup of the population considered at risk for developing mental health problems. So you see how universal is just kind of an overarching intervention. Here now we're promoting programs that target a specific subgroup. And some of those might be the list here. So you have school-based interventions, a specific group. What about high-risk teens? What about parent education for family-based programs? What about extracurricular strategies? Internet-based intervention programs, or comprehensive prevention strategies. Okay, so again, just targeting a specific group, and so these are termed selective interventions. And then you have indicated interventions, and these emphasize early detection and prompt treatment of maladaptive behavior in people, right, in their community setting, often due to a natural disaster. So we know that these natural disasters occur, and there's groups of people that rush out to these individuals because they have lost so much, and you can only imagine the anxiety they have. You can only imagine the depression that they have. And so if they can come in, detect early, treat promptly, hopefully these people will have a better chance of not developing a mental disorder and not being able to overcome it. Another topic here is the mental hospital as a therapeutic community. Milieu therapy incorporates ongoing activities of hospital into treatment programs, or what they call these therapeutic communities. There's also social learning programs, which use techniques like token economies and so on to help shape more socially accepted behavior. And there's also aftercare programs, which provide support for the transition from the institution to the community. So they really are trying very hard. We know now, because of the psychopharmaceuticals that we have, we're able to keep a lot more of these people out of the institutionalized setting. But it's more than that. When they are released, they need to have the social support around them. They need to have the environment to be conducive to them succeeding out in the real world. And so more of the aftercare programs, more of the transitional programs are I think, a focus right now. Here's your e-lecture topic item. Please complete that and turn in with your discussion thread for this week. Thank you. Okay, some legal issues, and I guess I'll just start with this now. There are, and I'm asked all the time by students, that they want to go into forensic psychology. They want to go into being one of these CSI guys, and they want to do profiling, and they hear all these terms because they watch the shows and that kind of thing. But I want to let you know that forensic psychology is psychology and the law. Okay. For those profilers and things, it might be good to have a psychology background, but those people go through the police force. Most of the time, those people are going to be police officers. They move to detective, and then they go to profiler or something like that. Years and years in the police force. So when we are speaking forensic psychology, and you'll see these in the slides today, we're talking about legal issues, psychology and the law. And I hope that I'm able to explain the field a little bit more. There are entire courses on forensic psychology, psychology and the law, and of course degrees in it as well. But these individuals will be more working in the courtrooms, working with identifying insanity and things like that. And so that's what we're going to cover today. Okay, so here's some prominent issues that a forensic psychologist might look at, like the right to treatment, the right to less restrictive treatment, the right to refuse treatment, or the right to live in a community. So this individual obviously broke the law. Depends on what they did. It could be a multitude of different things, but they're identified. Okay, this individual is unstable. This individual is possibly suffering from schizophrenia or something like that. So we need to make sure that they get treatment, just like it says here, the right to treatment. They're not going to need this very, very restrictive treatment if they're on proper medication. So these are the issues that these psychologists would be working with. Okay, what about civil commitment, right? To be committed, an individual must be dangerous to themselves and others. So this would be like a 5150 kind of thing, where they're a danger to themselves or others, and so they're going to be institutionalized. Incapable of providing for their basic physical needs, and or unable to make responsible decisions about hospitalization, and in need of treatment or care in a hospital. So you can see where there's the line is drawn by these individuals, to where there was a heinous crime, and on the law enforcement side of the room, you have these individuals say, no, this person just needs to be locked up. That's it, period. Throw away the key kind of thing. And on the other side, there's like, well, you don't understand their diagnosis. You don't understand their mental disorder. So let me help you out with what this person is suffering from, and then kind of coming to a middle ground on it. What is dangerousness? Right? Practitioners are asked this. It is very difficult to predict, and it's often over-predicted by mental health professionals. Okay. And we'll see this a little bit more when we talk about Tarasov's, which is next. There we go. Okay, so Tarasov decision set a precedent for therapists' duty to warn. It's basically the duty to warn ruling spelled out a therapist's responsibility in situations where there has been an explicit threat on a specific person's life, but it left other areas of application unclear. So you have to remember, this is just like with a mental disorder where there's the labeling concept, right? If this person is being labeled as dangerous, what does that mean? Does that mean that they're dangerous to themselves? Does that mean that they're dangerous to others? And again, there has to be a line drawn. There's going to be lots of confusion that exists around it. But that's what these individuals have to come to a decision on. What about the insanity defense, right? An insanity plea for capital crimes, that's going to be a big issue also. Just like I was telling you, law enforcement's like, no, this person is super dangerous. Look at what they did. They need to be incarcerated, right? Important issue in forensic pathology. And then what about not guilty by reason of insanity? Okay, so the NGRI, this defense is constantly questioned by both sides of the house. Were they criminal? Were they insane at the time in which they committed these crimes? So was it did they have the cognitive ability to stop doing what they were doing, or whatever it might be? What about competence to stand trial? Now, both cognitive abilities and psychiatric symptoms can be crucial factors in a person being able to stand trial. And again, these have to be all hashed out by those individuals, the forensic psychologist over here, and then your law enforcement on the other side. Does having mental health problems result in convicted felons being returned to prison after being released? The not guilty by reason of insanity, individuals can be released from confinement if when they are no longer judged to be of danger to themselves or others. However, 34% return to prison. Okay? And individuals with closer monitoring and higher restrictions had lower rates. So again, that's going to be the defense of law enforcement, that 34% of these people are going to be back. You're putting them on the street. And then the other people are saying, well, but you also have this other percentage that are not going to perform any crimes again. And so it's really a poor decision to keep this person in there when they have improved, right? So some organized efforts for mental health. Now we're back to the society at large. These aim to better understand, treat, and prevent mental illness. They're influenced by many countries by public awareness about and broad-based interest in mental health problems. We know a lot. Again, you're going to see banners, billboards, in magazines and on the web and so on, that you see these organizations for trying to promote mental health. U.S. efforts. There are several agencies here that work with this. The National Institute of Mental Health, the National Institute on Drug Abuse, the National Institute on Alcohol Abuse and Alcoholism. These are all federal agencies that work to promote mental health, and specifically just U.S. Also in the U.S., you have volunteer organizations like Mental Health America, the Organization for People with Disabilities, AA, Alcoholics Anonymous, National Alliance on Mental Illness. Private industry also promotes the efforts for mental health, research to identify mental health risk factors, and employee assistance programs. I don't know if you're part of a large healthcare network, but oftentimes you get flyers in the mail and stuff about eating right and dietary things, and they'll talk about depression and anxiety, and those are all preventative kinds of things. So that they're trying to promote mental health, so that if you are at the beginning stages, is not going to progress, or that's the hope, or you can just prevent it from happening by living a more balanced lifestyle. And then, of course, we talked about the U.S. Now we're talking about international, right? Leaders in international efforts. You have the World Health Organization, and you have the World Federation for Mental Health. And you can look up all these organizations. You can look them up on the web and identify kind of how they promote mental health. And then some challenges for the future. Much more progress in mental health must be made. Related or underlying social problems need to be addressed. And we're at the beginning stages of this, but more planning and collaboration at community, national, and international levels is imperative. And I'm glad it kind of summed it up for us there, because that's what we did. We looked at community efforts, national efforts, and then international efforts to improve mental health worldwide. Okay? And then how can we bring this back home to the individual? Well, volunteering at a mental hospital, community mental health center, or service organization is definitely helpful. Support realistic measures to ensure comprehensive health services for all ages, and then work to improve public education and government, reduce prejudice, and establish harmony. And this is a big component too. If any of you have children that are in school, you probably get letters also sent home that say, hey, become more involved with your elementary school or your junior high, and we have parent meetings, and we have this and that. And in a lot of those meetings, they will talk about mental health issues also. And just like what we were talking about, where mental health is associated with low SES and with poverty and this kind of thing, and we see that in our community. And so even if it's a parents group that works to help these struggling families, in the long run, you're probably benefiting those people's mental health. You see how that works. And so we need to be more active in our community. And that's it for this lecture. Thank you.